Trypanophobia. Trypanophobia is the fear of needles and injections, and it's a lot more common than people think, with some studies estimating that around 1 in 10 adults deal with it in some form. The strange part is that unlike most phobias which speed up your heart rate, trypanophobia can actually do the opposite. When some people see a needle, their heart rate and blood pressure suddenly drop, which is why fainting during a blood draw or a vaccine shot isn't rare at all. It's actually a recognized medical response called a vasovagal reaction. This fear is also one of the biggest hidden reasons adults skip vaccines and delay blood tests for years, even when they know it's bad for their health. Iatrophobia. Iatrophobia is the fear of doctors and medical settings, and it goes way beyond just feeling nervous before an appointment. People with it can feel real panic just walking into a clinic, and there's actually a clinical version of this that doctors see all the time called white coat syndrome. This is when a person's blood pressure spikes the moment a doctor walks into the room, even if their blood pressure is completely normal everywhere else. It's so common that doctors now double-check blood pressure readings taken at home because the hospital numbers alone can be misleading. Odontophobia. Odontophobia is the fear of dentists, and it's one of the main reasons people avoid checkups until a small cavity turns into a serious problem. For a lot of people, this phobia starts from one bad childhood experience, a painful procedure, or even just the sound of a drill, and the brain locks that memory in permanently. The tricky part is that avoiding the dentist because of fear usually makes the actual problem worse, which means the next visit is even more painful, creating a cycle that's hard to break. Nosophobia. Nosophobia is the fear of developing a serious disease, and it's different from just being health conscious. People with nosophobia can convince themselves they have a serious illness based on something as small as a headache or a random skin mark. They'll Google symptoms obsessively, check their body constantly, and seek reassurance from doctors again and again, but the reassurance never actually lasts long. This pattern is closely linked to what's clinically known as illness anxiety disorder, and it can be exhausting for the person living with it. Emetophobia. Emetophobia is the fear of vomiting, and it's considered one of the most disabling phobias because of how much it can control someone's daily life. People with severe emetophobia will avoid certain foods, skip alcohol entirely, refuse to travel, and even avoid being around anyone who's sick, just to reduce any chance of vomiting happening near them. What makes this phobia interesting is that it's rarely about the act itself. It's about the complete loss of control that comes with it, and that fear of losing control is often stronger than the fear of actually being sick. Hemophobia. Hemophobia is the fear of blood, and just like trypanophobia, it can trigger that same sudden drop in heart rate and blood pressure, which is why people with hemophobia are famous for fainting at the sight of blood. Scientists actually have a theory for why this response exists in the first place. The idea is that ancient humans who fainted or froze at the sight of blood were more likely to avoid predators by appearing already dead. So in a strange way, this fear might be a leftover survival mechanism from thousands of years ago. Pharmacophobia. Pharmacophobia is the fear of taking medication, and this one causes real dangerous problems in modern healthcare because people with this fear will often skip doses, stop taking prescriptions early, or avoid starting treatment altogether, even when they genuinely need it. For someone managing a chronic condition, like diabetes or high blood pressure, this fear isn't just uncomfortable, it can directly lead to serious health complications, which is exactly why doctors and pharmacists are trained to recognize the signs of medication avoidance early. Tomophobia. Tomophobia is the fear of medical procedures and surgery, and it's often considered one of the most intense phobias on this list because it combines almost every other fear on here into one moment. The needles, the doctors, the blood, the total loss of control, all happening at the same time. People with tomophobia have been known to delay life-saving surgeries for years purely because the fear of the operation itself feels bigger than the fear of the condition it's meant to treat. And in the most extreme cases, this phobia has led people to refuse treatment entirely, even when doctors warn them of the risk. If you made it through this list and recognized even one of these in yourself, you're not alone. These phobias are more common than most people realize, and understanding where they come from is usually the first step in dealing with them.